Hello people, good morning to all of you. My name is Kavithaprashanth. I'm founder of Tots and Moms Foods. And here, as we had already announced, we are going live with Dr. Gaurang Ramesh, and the topic of discussion today is lactose intolerance in babies and kids. I'm going to add Dr. Hospital's account, Arka Health. So Dr. Gaurang Ramesh is a gastroenterologist, and he will be the right person to tell us more about himself.
Hi.
Welcome, doctor. Thank you for
Thank you for
joining in.
inviting me.
Thank you so much, because this is a very important topic, and listening it from a professional adds a lot of value to our audience. We have an audience who are more of parents, because this plays all together. We talk about parenting, we talk about food, we talk about their digestive health, and of course, gut health is something which is long pending that we haven't spoken. And most of us are also evolving to learn what is gut health. So, people, we are so, blessed to have a gut health doctor today. So, we recently made a video on how important is gut health in babies and kids. And over a period of time, it impacts in different ways. But if it is taken care in the initial stages, it is taken care for life, is what I'm sure doctor would agree with me on. So I will give this chance to him now to introduce himself, so that we take up questions that we have. I'll just tell you the format of this live session. We have noted a set of questions about lactose intolerance, and later we will give you a chance to put in your questions. We will choose questions that you posted here on the session, and then doctor will also answer those questions. So doctor, over to you.
Thank you for the opportunity to be live with you on Instagram. I'm actually a surgeon.
Thank
I did my super specialty in surgical gastroenterology. And then when we sit in the OPD, we see a lot of cases who are chronic gut conditions, whom I felt we are not doing justice with the treatment and the current healthcare system is doing. So that is why I again further went on to study functional medicine from Institute of Functional Medicine in US, and this actually brought a huge perspective change in me, because in current healthcare system we don't understand the importance of microbiome, we don't understand the importance of how to improve the microbiome to improve the gut health. So it's mainly symptom management which is going on in the current system, and we need to actively go into, instead of just managing the disease, we need to progressively create health. We need to talk about creating health rather than just maintaining the disease or managing the disease. So that is, I
Exactly.
realized.
Lifestyle changes are necessary, is what you're telling. Your voice.
Yeah, so that is the shift we need to make from just going to the hospital and thinking about health only when we are ill, to actively, making efforts to become healthy and preventing diseases.
Very well said. Once we take care of the basics, I think everything will be taken care of, is what modern science and also ancient science believes in. And we are blessed, as I said, to have you today. And I'll quickly jump into the topic, which is lactose intolerance. In simple words, what we understand is it is milk allergy, causes bloating, gas issues in children, and in medical terms, or something that we can understand, please tell us what is lactose intolerance, and then other
Yeah,
questions.
so the lactose intolerance has become a famous word because that is how we understood milk digestion has. So milk predominantly has two proteins, lactose and casein. It has other proteins also, but these are the two prominent proteins. And lactose is something which we need an enzyme called lactase enzyme in the body to digest the protein. So first, to understand lactose intolerance, we need to know that there are multiple types of lactose intolerance. So we have a congenital lactose intolerance where the baby is born with a genetic defect. It is an autosomal.
Would be great. I'm not sure if it will cut the session or interrupt the session. I'm not sure.
Okay, I'll just try to join with cellular data.
In case we lose doctor here, I will add him later. Yes, Indumati, working on it because I know how important this topic is.
60,000 people, you might see one person who has this genetic defect. So this is not something which is popular, and why lactose intolerance has become, so widely available. I mean, widely talked about, because it's not a common disease. The second one is the primary lactose intolerance, where gradually during the late childhood or during adulthood, they develop lactose intolerance because their body stops producing the lactase enzyme. That can also happen because if there is a small risk in genes, or it could be a multifactorial problem where the lactase enzyme is reduced production of lactase enzyme is happening. The third problem is the secondary lactose intolerance, where because of other issues, external factors, our body stops producing the lactose enzyme. It could be an infection, viral infection, bacterial infection. It could be the environmental triggers, which is not allowing our body to make the enzyme properly. Or it could be, the stress which has caused, gut problems and IBS, which has led to deficiency in the lactose enzyme. So right now, although lactose intolerance is the popular word, the problem which we see a lot is with the milk itself. So we need to look at the other protein also, which is the casein. So casein is 80% of the milk protein is actually casein, and genetically we don't have a problem digesting casein. Most people digest casein well. But because of the way we are living now, right from the time the baby is born, so most of the deliveries happening today are cesarean sections. So before, when vaginal deliveries used to happen, the child would be exposed to the vaginal microbiome of the mother as the child comes out, and then the child is exposed to a better variety of microbes while the child is born. Now, in a cesarean section, we are making the child, come out in a very sterile environment without any exposure to microbes. And all the time, we are making sure we are living in a very clean environment, sterile condition, where the child is not exposed to microbes at all. So, because the microbial exposure is not happening, the microbiome of the gut is responsible for a lot of things, including digestion and hormones and immune system and so many other things. So when the microbial exposure is not happening, we tend to develop food intolerances which we are not genetically predisposed to. So many of the kids who develop bloating, abdominal discomfort, increased frequency of stools, it can be because of acquired milk intolerance, may not be lactose intolerant itself. It could be difficulty in digesting casein and the other aspects of the milk. And the third thing which we need to look at in the milk is the way we are getting milk. So right now, since about 1960s, 50s, all the cows are genetically modified to produce more quantity of milk. So right from the cow matures until the cow dies, we want to extract milk from the cow. So to do that, we are continuously feeding the cow with a lot of feeds which have pesticides in them. We are continuously giving antibiotics to the cow so that it doesn't fall ill. And we are also continuously giving hormones, which we are artificially giving. The cow has to produce milk. And even when the cow is pregnant, it has to keep producing milk. So that is how it is done in dairies. So imagine when the cow is pregnant and all the female hormones are haywire and so much of estrogen is happening, and that is coming into the milk. And we are also having the pesticides and the toxins and the hormones which we are injecting and the cow is producing. All that is getting reflected in the milk. So that is why today it's not the same what it was 50 years back, where everybody could tolerate milk. So right from children till adults, many people could be having difficulty in tolerating milk, and you don't have to always develop big abdominal symptoms. You don't need to develop diarrhea when you are casein intolerant or milk intolerant. You can just get eczema, skin rashes. You can develop sinusitis. You can develop pharyngitis. You can develop this. Yeah.
That's what was my next question, doctor. What are the symptoms? Because in a predominantly milk-fed country, which is India, milk and milk products being taken so widely. I'll also come to basic questions like what are the concerns when we feed cow's milk to babies below a year, because that is also most commonly done in most places, not in urban cities for sure, but in other places. So let us clearly note down the symptoms so that we are well aware.
We'll start with the primary problem, which is the primary lactose intolerance. So in this, the lactose enzyme is deficient. So when the lactose is there in the milk, it's not getting digested. So when it's not getting digested, it is pulling water into the intestines. So the baby develops diarrhea. And then because the lactose is not getting digested, the content in the intestines become acidic. And then it develops a perianal rash. So there are reddish color skin rashes around the anus of the baby. And then gradually, if the problem is not identified at this time, then the baby goes on to develop improper digestion and malabsorption. So even normal foods, the baby will not be able to digest properly and absorb properly. And then the baby may have failure to thrive. That is, the normal developmental milestones will not be happening because the absorption is not happening. So this is with respect to primary lactose intolerance. But when it's secondary lactose intolerance, it's an acquired disease. So the baby might have had an infection, viral infection, bacterial infection, after which the baby is developing symptoms specific to milk. So when you give milk, the baby's diarrhea is increasing, frequency of stools is increasing, and again perianal rash is happening. So that happens in secondary lactose intolerance. But when it comes to other proteins of the milk, just milk intolerance because of casein, then it may not be diarrhea. The baby might just be forming unformed stools. It can be having difficulty in stool formation, difficulty in evacuation, spending more time in the toilet, or it could have other problems like pharyngitis, eczema, sinusitis, frequent allergies. Even those symptoms can be related to milk intolerance. So it's very important to evaluate properly. So simple lactose intolerance is easy to diagnose. But when the baby is able to digest lactose and other proteins in the milk are the problem, then it may not cause full-fledged abdominal symptoms like diarrhea. It could just be bloating and other symptoms.
What is it that when we know these are the symptoms, we will visit a doctor? Is it that we need to visit a specialist like you, or a medical practitioner in general, or a pediatrician will be able to
find the most simple diagnostic test you can do is to stop giving milk and then seeing how the symptoms improve. So pediatrician is the best person to reach out first to diagnose the problem and make an accurate diagnosis. And the best test would be an elimination diet of milk. It doesn't require any invasive procedures, nor drawing blood. So just eliminating milk can show the difference when they are pure lactose intolerance. But when they are intolerant to other proteins like casein, then just elimination will take time to get rid of symptoms. The baby might take probably 2-3 weeks later, the baby might start responding if they are intolerant to other proteins.
So elimination, for how long do we need to observe if the bloating issues or the other symptoms that you have spoken about, to monitor and to be sure and then visit the doctor? Because these are certain things that we can simply do at home when we know these symptoms. So
Yeah,
how
so
long do
lactose
we stay
intolerant, the
with?
baby will start getting better within 5 to 10 days. You know, you just stop milk and within the 3 to 5 days, it starts improving, stool formation will start happening. And within 10 days, you know, the stools become normal. But if it is other milk intolerance, casein intolerance, then it may take up to 6 weeks. So you need to eliminate for 6 weeks. If it is clear-cut diarrhea, peritoneal
So if
rash,
we
and
know that
diarrhea and loose stools, then within 10 days you can expect, you know, significant changes in the baby. But if it's non-GI symptoms like eczema, pharyngitis, sinusitis, then you should eliminate for 6 weeks.
Okay. And as we were also discussing it, in India, it is so common to give cow's milk or animal milk rather. People have inhibitions of what if my baby is not taking milk, what to do for the calcium. They will still continue to feed that. Okay. And definitely this hesitation and the societal pressure, people at home, the elders, oh, milk cannot do anything to your child. Milk is necessary or mandatory. These are the words and the societal pressure, obviously. So, in case somebody continues to do this or continues to offer milk to a child ignorantly or with the pressure, what are the things that our children may suffer with, or what can we need
Again,
back?
we need to
Or
be
cases that you
very
have seen.
careful about when we say milk. Is it the breast milk or the cow's milk? Is what we need to.
Now I'm talking
Okay.
about animal milk or cow's milk. We will come to breast
Okay.
milk, that is also
So
there in our list.
yeah, so what this might be a controversial statement I'm doing, but uh, what has driven our science and our guidelines about milk consumption has predominantly been funded by the dairy industry. So if you see even the American guidelines, because in India, health system always follows the US or the Britain health system. And in US, they came out with every adult has to have 2 glasses of milk and children have to have, every adult has to have 3 glasses and children have to have 2 glasses. So, and then we are also following that same direction. And today we can see that there is so much evidence that milk is, especially animal milk, there is no evidence that it is absolute requirement for calcium. It is not a holistic, you know, a food. And there are better sources of calcium in the vegetables, which give you more calcium than milk. Yeah.
Than milk, one glass
And
of.
the risk for developing osteoporosis also, there is no evidence that adults having milk have lesser osteoporosis. In fact, there are studies in Europe showing that adults who continue to have milk have more chances of developing osteoporosis. So right now there is absolutely no evidence to say, at least for because of the milk we are having now, there is no evidence that it's an absolute requirement required for calcium, and there are many other substitutes for milk to get enough calcium.
Yeah. So osteoporosis is one thing that we spoke about, and what are the serious impacts that you have observed or you have treated children with due to lactose intolerance or being fed
Yeah,
again and again
so
with this mindset?
very common thing I've seen is I'm basically I treat mainly adults, but I still get a lot of children because of gut issues. I see children who are having allergies. It can be skin allergies or it can be sinusitis, pharyngitis, and all that. And their parents forcing them to have milk. They tell their parents, "I'm not feeling great when I have milk. I
Exactly.
don't like milk," and still parents force their children. And the minute we eliminate milk, within 6 weeks they feel much better. Their sinus is clear, their nose is clear, they're sleeping better, and their frequency of allergies also reduce.
Okay. Okay. Fine, doctor. Noting this. And now another main confusion, and most of them have even stopped giving breast milk to their children. assuming that their breast milk is intolerant to their children. Yes, there are cases. I'm sure you will be able to tell us the percentage. As you said, in 60,000, 1% is lactose intolerant. What is the percentage of babies being lactose intolerant to breast milk? And how is it wrongly diagnosed and how can it be rightly diagnosed? And what is it that a mother needs to do when, because again, this is something controversial. Maybe you mistake me because I am telling it to the doctor fraternity. There are few doctors who would not even diagnose and just abruptly say, go buy a formula. Your child is allergic to breast milk. So at that point of time, what a mother needs to do. Maybe if it is right, she has to do the right thing. But if not, if it was just a statement and it is impacting your child in multiple ways, because breast milk versus formula milk, there is a huge difference which everybody knows. But to make up the decision, to be sure of what is a mother or a parent.
Yeah. So basically, when you have, like you said, it is very rare that a child is genetically cannot tolerate breast milk, only if it's congenital lactose intolerance. There are cases where even primary lactose intolerance have been able to tolerate breast milk, but there is a chance that even primary lactose intolerant will develop symptoms for breast milk. But any other like secondary lactose intolerance or simple diarrhea, we need to evaluate further because there is a root cause which has happened. It could start from the birth of the child, where the child has been admitted in the ICU, given a lot of antibiotics, had an infection at birth. After that, did the child, develop this? Then the microbiome has to be corrected. Is it the problem with the mother's health? If the mother is not having a healthy lifestyle, healthy diet, is some toxins getting transmitted from the mother to the child through the breast milk because of the unhealthy lifestyle and diet of the mother. So that also has to be looked at. And we also have to look at the environment of the child. Is that contributing for the child to develop symptoms? And is the breast milk being blamed because of the environment? So that is where we need to get into a little root cause. It's not possible, to in 10 minutes to diagnose or 5 minutes what it takes in a doctor's appointment office to diagnose the root cause of diarrhea in children. And to improve the children's health, you can eliminate for a certain amount of period, and then during that elimination, it is very important to give whole food, plant-based feeds. So that actually improves the microbiome health. And then reintroduce with breast milk only, because if you reintroduce cow's milk as a test and the gut is still not in a ideal condition and the patient child develops symptoms, then again we'll blame it on milk, or we'll call it lactose intolerant and make it generalized, because breast milk is much more well tolerated than any other milk, because the fat content in breast milk is much higher compared to the proteins. And always the proteins are the ones which causes problem in milk, and it's not the fat.
Yeah. The animal protein, I always say when people ask us in simple words that cow's milk is meant for calf and human milk is meant for humans. So the allergy issues obviously are very less. But in simple words, if you have to tell what are the things that a mother, in case like a warning sign that she has to again have a second opinion on this, in case a doctor says your baby has to stop being fed the breast milk with.
Yeah, so the baby, the long-term sign, short-term sign, what you can see is the stool formation is not happening properly. So after 6 months, when you start feeding, introducing solid food, up to 6 months, you need to, the stool formation is like a paste. Okay, after 6 months, the baby starts getting solid stools. Once you start including little solids into the baby's food. So if the stool formation is not happening ideally, that is a sign. If the stool frequency is still high, then that is a sign. And if the baby is not gaining weight and developing normally, you have to go back to the pediatrician. And if the baby is not is losing weight, So the weight loss will happen only in the initial few weeks of the birth. After that, after 6 months, there has to be weight gain. Yeah. So if that happens, then again you have to go to the pediatrician.
Fine, doctor. Thank you so much for the information. So, people who are online, please post in any questions that you have. We have Dr. Gaurang Ramesh here. We are talking about lactose intolerance. If you have joined us right now, the video will be saved for future reference. My next question is, now that some kids are being offered formula milk for a certain reason from the initial days, especially the infants. Now, is there a possibility that they have intolerance towards formula milk? Because I have heard from a mother who said that my child was intolerant to certain formula milk, and I had to get it from US. It costed me around 3.5 lakh for the whole period of giving formula milk. So, what is your take on this? How would a mother know that my child is not getting adjusted to this formula and should switch to other formula? And if you can quickly tell what are the best formula variants for a child who is intolerant or having regular bloating issues. But it is common that compared to breast milk, formula fed babies have regular issues in digestion.
We need to really look at what is the reason we are shifting to the formula milk. And when you say getting it from US, what exactly is it? Is it just formula milk or the entire
formula milk? Yeah. I mean, it was just an example. What I meant was people switching from one formula to other. Is it lactose intolerance? Because they come up with concerns that baby is not digesting.
Yeah, so that's the thing. When we are not able to identify the cause for indigestion, we tend to blame it on lactose, which is actually should not be done. So lactose intolerant is a very small population which happens. So we need to look at all aspects of the formula. And if the baby is not digesting it,
what you mean is, I mean, stylishly, let's not put in everything into lactose intolerance category. It is a big topic altogether, and there are so many diversifications which a specialist can only talk about and support you.
Yeah, so we need to look at like for example, there are other products which now currently what's happening in formula milk industry is they're looking at only calories. They're looking at adequate amount of calories from proteins, carbs and fats. But the problem with the gut is if the baby has a bad gut, the microbiome has to improve, and only then the gut health will improve. So for that, it's very important to have prebiotic fiber. So that is why so many of your recipes which you have been posting may be working much better than formula milk, because this wholesome plant-based nutrition, which is simpler to digest, and it's also feeding the microbiome. So that trial should be done always before considering formula milk. And if the baby is only digesting formula feeds and formula milk, then that means there is some gut dysbiosis, enzyme deficiency, intestinal wall problem, or the mucosal problem, which
Dipanshu is asked, what are the health protein options for someone having SIBO?
Protein
Not sure
options
if it
for
is related to kids. Someone having SIBO.
Yeah, so SIBO basically is basically small intestinal bacterial overgrowth. So there are certain oligosaccharides, monosaccharides, complex carbohydrates, and certain proteins which we don't have inherent enzymes to digest. So the microbiome actually helps us digest in that. And when then there is a microbial imbalance, we are not able to digest these proteins. So for them, while they are in the recovery phase, it's always best to completely avoid milk. And in fact, fermented milk also should be avoided. to recover properly, because in SIBO it's very difficult to exactly say which is the bacteria which is causing problem, and what are the carbohydrates or proteins which you are not able to digest. So we need to do a proper elimination diet and then start reintroducing one by one after 6 weeks. So then you'll be able to, there's no blood test, there's no lab test to exactly say which is causing problem in SIBO. It has to be done as a eliminatory diet.
Fine, doctor. So we have almost covered all our questions, and thank you for answering all of them. Are there any 2 cents before we close?
Yeah,
this
so
session?
I would like to say, in this age of post-COVID sterility kind of an age, it's very important to allow our children to get exposed to mud, get exposed to the earth, and
So well said, especially during summer vacation when they are locked inside the room. Just yesterday, I was making a video and I was telling them, please allow your child to go out. If you think the sun is so harsh, let them go early in the morning at 6 o'clock or something. So you are so well aligned with our thoughts.
Yeah,
So
that is very important to expose the kid to the microbes, and that's when the microbiome and the immune system develops. So that is the best way to prevent secondary lactose intolerance. And always you cannot blame everything on lactose intolerance. You need to look at what the fundamental problem is by doctor's consultation or by eliminating and checking if the baby improves. And today's what you are getting in the market, dairy, is absolutely not a necessity for the body. In fact, we are well off not having milk than giving our child hormones and pesticides filled milk.
very true. Early menarche, girls, so many other issues we are facing on a regular basis. We are seeing digestion-related issues. So thank you so much, doctor, for bringing in this knowledge to our audience and even to me personally. I mean, reading articles and listening it from a professional are two different things, and I'm happy that I'm able to get one video for my Instagram channel. I'll also be posting this on YouTube and Facebook, where we have a lot of audiences. And ever grateful for joining in this live session. We will again bring you back. We will post in questions that our audience want to know. Doctor, please, audience, comment on this video. Save it and let us know what are the other questions we can bring in this week talking doctor. Dr. Gaurang Ramesh, and he practices in the Arka AV Hospital. Would you like to say that if somebody wants to visit him?
So currently I'm mainly practicing in Arka AV Hospital in JP Nagar. It's on the ring road in JP Nagar 6th phase. Bangalore. Yeah,
Bangalore. Our audience are.
I also do online consultations, so you can reach out on Instagram or on the website. We can also do online consultations.
Yes, please reach out to him. And I am Kavitha, founder of totsandmoms Foods. It is an organic, chemical-free food store where you can find foods for babies, kids, porridge mixes, pancake mixes, and cookies are some of the range of products that we have. Do have a look. And yes, thank you all of you.
Thank you so much.
Doctor, again. Bye-bye.